Hi and welcome to UroChannel. When I started my specialization into sexual medicine 10 years ago, it was with a focus on cancer patients. Above all, prostate cancer, because it is the most common cancer in men, but also bladder cancer, rectal cancer and colon cancer all carry a high risk for sexual dysfunction because of the nature of their treatment. This is a video about the rationale for penile rehabilitation in cancer. It is very important to understand the why before the how, because evidence suggests that adherence to rehabilitation programs is poor. This is why it is very important to comprehend the essentials of penile rehabilitation. My name is Stefan Buntrock. I'm a urologist and sexologist. Becoming diagnosed with prostate cancer is an imprinting experience for most. A lot of men didn't even know what a prostate was, let alone that they had one. And suddenly it's cancer. Cancer equals death to many. But times have changed. Gradually, cancer has begun to shift. More and more can be cured because thanks to PSA, it has become much easier to detect the disease in the early, still curable stages. And for those who can't be cured, the disease is slowly shifting from a deadly to a more chronic illness. Most prostate cancer patients will survive for many years. This means that the quality of the survival has begun to play a more central role. Survival that is very much defined by continence and sexual function. But at the time of diagnosis, for the majority, it is survival that counts. And often they are so occupied with that, they don't have the capabilities to care about the other stuff. And this is okay, because this is maybe the most important aspect at the moment. But for me as a doctor, I try to stay ahead of things. It is my task to set the course right from the start, because I know that in 2 years from now, there will be other questions. Questions about sexuality, questions like, when will I regain erectile function, doc? And I will know that at this point, much will be lost because many opportunities were left unused in the beginning when survival was top priority. When it comes to erections and prostate cancer, there is one bitter truth. More or less every treatment is detrimental to erectile function. There are only very few who don't experience a negative change in their sexuality and erectile ability. How erectile function is defined will determine the results in scientific studies. There are only few papers I have read that reflect what I perceive as realistic results. I mean, whom are we talking about? Most prostate cancer patients are in their 60s. Statistically, 60 to 70% in that age group suffer from erectile issues. Studies that state that 90% are fully potent after radical prostatectomy suggest that prostate cancer treatment is working like some kind of Viagra, which it doesn't. So what is the rationale for penile rehabilitation? It is about increasing the chances for recovery even before treatment has started. One crucial element are the two erectile nerves. Anatomically, they run directly alongside the prostate. For erections to happen after the prostate has been removed, it is mandatory that both are spared. One is better than none, but the chances of recovery get much less with only one of the two nerves spared. The problem is, even in the most perfect of all scenarios, the erectile nerves will cease to work for a certain period of time after the operation. Why this happens is not completely understood. It may take a while until they start to fire again, but during this period, there will be no erections. And this is not good, because with erections, blood enters the penis, and blood contains all the good stuff that makes cells happy. When regular erections fail to appear, cells start to die. This will leave scars in the tissue of the corpora. They will start to shrink and gradually lose functionality. By the time the nerves start to fire again, it might be too late and the penis doesn't work anymore. Venous leakage is one of the most common conditions. The organ not only has to fill with blood, blood will have to be trapped inside the organ too. With scarring, the penis will get smaller, which in turn will compromise the mechanism that keeps blood inside the organ. So blood enters the corpora and immediately flows out again. This is what venous leakage means. The rationale for penile rehabilitation is to make sure that as many cells as possible survive until the nerves resume their work. How do we do that? with erections at the earliest possible time, and we start making use of nature, because erections happen naturally during sleep, more specifically in REM sleep, when the eyes are moving rapidly and the person is dreaming. Increasing nighttime erections is an elegant way to promote penile rehabilitation. And this part begins even before any treatment. How this is done will be the topic of the next video in this series. Don't forget to subscribe so you will be notified as soon as I upload part 2. Thanks for watching. Bye bye. Yes, I did it.